Well, I think that relates to the TV.
Oh, I don't know.
Anybody on our technical staff know whether these buttons, I think, okay, good, okay. On Friday, at Friday's committee meeting, the chairman's amendment in the nature of a substitute was pending when the committee recessed. The substitute is open to amendment at any point. However, to promote orderly and thoughtful deliberation of the amendments, as I described in a memo distributed to committee members in advance of the markup, I will exercise the chair's power of recognition to give priority to amendments in order of division, starting today with Division C. I will also exercise the chair's power of recognition to prioritize recognition of members offering amendments that have been submitted consistent with a 2-hour advance submission policy I discussed in a memo to members and in previous markup sessions. I now turn to the pending amendment in the nature of a substitute.
Would the gentleman yield for a question
yes,
on timing?
Yes.
I think the chairman may be aware, may not be aware, but there are quite a few rumors floating about this markup, one of which was that we weren't even going to convene today. So you've already disproved that one, which is good. Could you inform the minority what your intention is for the rest of today, and then beyond that, the rest of this week in terms of your markup schedule?
We are going to be meeting until there are votes on the floor. Then we will break to respond to the votes on the House floor. Usually that occurs around 6:30. We will then return. The chair is providing dinner to both sides of the aisle.
And we thank you in advance.
For members so that we can continue our markup, and we'll probably go to 11 or 12.
Okay. And then the balance.
And we will be meeting tomorrow, and I think we're going to, have we decided on that issue? I believe we're going to convene tomorrow afternoon at 2.
But it is your, as of right now.
And we will then go into the evening.
It's your assumption as chairman that we're going to have a complete markup, and not, you don't see a scenario where we would suspend or stop the markup sometime this week.
We're in the markup. We'll continue with the markup. There may be changes, but that's my intention at the present.
We totally support that on the minority. We, as you know, have a number of amendments, and we fully look forward to a positive and constructive markup process this week in this committee.
Thank you.
Thank you.
So we have pending before us amendment in the nature of a substitute. The Republicans would go first with an amendment, since we've got, so the last amendment we considered on Friday was on the Democratic side. Mr. Deal, you're seeking recognition.
Yes, I do.
What is the number of your amendment?
The number I have is 298, mandates on states number 3.
Let me ask the clerk before we consider that amendment. Is this an amendment to Division C? Was the amendment submitted with 2 hours lead time for committee review, and are there copies for distribution at the desk?
One moment, Mr. Chairman, we're checking.
Okay.
I know.
Mr. Deal, what's your number again?
Deal 201.
Your number of your amendment?
201. Yes,
201?
Mr. Chairman, I'm informed it's 201.
201.
I'm sorry.
It's been there since Friday.
Yeah. Clerk will, I asked the clerk a series of questions.
We have it, Mr. Chairman.
I asked the question of whether this relates to Division C.
It does.
2 hours in advance, and you have amendments to distribute. Okay,
Yes.
The answers are in the affirmative. The clerk will report the amendment.
Amendment offered by Mr. Deal of Georgia. In Title V.
Without
of
objection, the
Division C,
amendment will be
strikes-
considered as read, and I recognize the gentleman from Georgia to speak on his amendment.
Thank the chairman. Mr. Chairman, this amendment relates to the authority of the Health Choices Commissioner and would restrict that authority so that he could not deem a state that offers a state health insurance plan to its state employees as being out of compliance with a federal standard. As we all know, our states choose to offer plans of health insurance for their state employees and those who under their state law are entitled to coverage. And I do not think that it would be the intent of this body to allow this federal Health Choices Commissioner to, in effect, override the decision that has been made by the elected officials at the state level as to what they think is appropriate to be offered to their state employees. And this amendment would simply clarify that fact. Let's take, for example, we do not know for sure what would be a mandated coverage question, but let's assume that it may be something as at the federal level that would mandate that an abortion or a Botox or things that might be out of the mainstream be required at the federal level, and a state plan might not offer that. I don't think we would want the state to be told that they're going to have to pay an 8% employer tax for being out of compliance with the federal standard. And that is the gist of the amendment, and I would urge its adoption. I will yield back.
Gentleman yields back his time. Who wishes to be recognized on the amendment? Well, the chair will recognize himself for 5 minutes. As I understand this amendment, while it we're considering it in Division A, it would ordinarily be thought of as something that would come up later in the bill, but it is a provision that does only one thing. It requires the state and local governments in their roles as employers to follow the same rules that all other employers must follow, no more and no less. And the gentleman for Georgia would strike that requirement in the legislation. It is in the Public Health Service Act part of the bill, unlike what other employers being covered under Division C, because if the governments don't provide what the other employers would be required to do, then they wouldn't be eligible for federal funds under the Public Health Service Act. And this is the way this committee has reached other requirements, such as the COBRA insurance continuation and other matters that relate to local governments. We don't rely simply on mandates that are in Part A, because there are some in the legal community that argue that under the Constitution, the federal government can't simply order the states to do things. So what we say is that the states don't have to do this. They don't have to provide their own employees coverage. But if they don't give their own employees coverage, they're not going to get funds from the federal government. And in all 50 states, local governments are created by state law. They may be called cities or counties or parishes, but they're creatures of the state. And the statutory language requires the states to assure that localities will comply in the same manner as the states do. It doesn't cut off funding immediately, allows flexibility for the states to work with localities to come into compliance. If we're trying to get people in this country covered with health insurance, we think that governments at the state level and the local level should provide insurance coverage for their employees as well. And the gentleman from Georgia's amendment would strike that requirement, and we think that requirement should stay in the bill. So with all respect to the gentleman from Georgia, I disagree with his amendment and urge members to vote against it. Further discussion. Mr. Barton.
Mr. Chairman, I'm going to rise in support of the amendment, but before I do that, I have a question or two for the council. Under the provision that Mr. Deal is attempting to strike with regard to the states, is it true that if we don't strike this and the bill stays as is, that the federal government could withhold grants from states if they didn't comply with some of the mandated requirements for health coverage of their state employees?
Yes, sir.
It is a true statement.
Yes, sir.
Well, that's a straight answer. Okay. Is it true under the provisions of the bill, if not struck or amended, that if the federal government required abortions to be covered, a state would have to do that or it could lose grants?
If the Secretary acting on advice of the Benefits Advisory Commission had made abortion a minimum benefit for any acceptable insurance package, yes, sir, they could withhold that.
Okay. Thank you. And thanks for the non-technical answers. I appreciate that. Well, Mr. Chairman, I do want to oppose this. I want to support this amendment and oppose the base text of the bill that Congressman Deal is attempting to amend. I don't think too many members of this committee really want to tell us a sovereign state of the Union how to manage their health care plans, and I certainly don't believe we want to give a commissioner, if I understand the bill's term right, the authority to enforce those health mandates by withholding grants. I'm only aware of one provision in federal law where currently we give an administrator or a cabinet secretary the ability to withhold grants. In the Clean Air Act, we do give the EPA administrator, I don't know if we give the direct right to withhold highway funding, but we certainly, it is an option that the EPA administrator can use when trying to get states to enforce or to comply with certain of the requirements of the Clean Air Act. And that particular authority has been threatened repeatedly, but I'm not aware that it's ever been used, unless it may have been used once for the city of Atlanta.
Well, maybe council can answer that question if it's ever been in the statute before or ever used.
Mr. Barton, Mr. Waxman, this provision is modeled on one that is already in current law for the provision of COBRA continuation benefits for health insurance that require employers to provide 18 months of coverage after severance. It has been in law for 25 years, also subjecting all public health grants to jeopardy if the state were not to comply. There has been no non-compliance, and no state has lost eligibility from this provision.
Well, it's a huge. I'm happy to yield to the chairman. Sure.
We're telling employers that we want them, that if they're going to provide health insurance to their employees, to meet a minimum standard. Why not tell the states as employers to meet a minimum standard as well? The difference is we can't tell the states what to do directly. We have to use whatever leverage we have over them. The Constitution says you can't tell states what to do, but we could put a condition on it. If states want public health money from the federal government, one of the conditions would be that they are going to treat their employees as fairly as any other. The other point I wanted to make is your question about abortion was a hypothetical question, not a real one.
Well, that's a real question.
Well, it seems to me highly unlikely that the Secretary is going to demand that every plan in this country have abortion services. And I think we'll probably have amendments to that in that regard.
Would the gentleman Texas yield?
Let me make a point. The chairman's support of the amendment, to me, is an eloquent statement of why we shouldn't do it. It is chilling to me that we're on the verge of preempting state sovereignty and telling states, pressuring states what they have to do. Why have a state? If what the chairman just said is the I don't know how to say this, is the no, I'm not. if that is the philosophy behind this bill, it really calls into question the federal system.
Would gentlemen,
My time has expired. Can I have
Without objection,
one additional minute?
gentleman will be given one additional minute.
And I will yield to the author of the amendment.
I thank the gentleman. I would simply point out that this amendment will keep you from having to explain to your governor, to every member of your legislative body at the state level, potentially to every mayor and every city council in every city and municipality in your state, why they cannot choose the kind of health insurance policy that they want to offer to their employees. If the thrust of this bill has as its premise covering the uninsured, state employees are not uninsureds. Local municipality employees are not uninsureds. Why do we want to take this bill to the level of taking away all state rights, all local control on issues as fundamental as this? And if this amendment is defeated, you will in effect be doing exactly that. And I would thank the gentleman for
If I still have 30 seconds, there's just a basic philosophical difference between the majority and the minority, or at least between the chairman and Congressman Deal. We think competition in the marketplace is the way to provide the best health care plans. We certainly think states who don't normally pay as well as the private sector, but most states do have premium health care plans, should have the right to pick and choose and to develop the health care plans they provide to their employees. We do not believe, we on the minority side, that what we really want to do is create a system where a federal health commissioner is telling the states what they have to do in terms of their health coverage. So I would strongly support Congressman Deal's amendment. Thank you, Mr. Chairman, for the extra.
Gentleman's time has expired. Mr. Stupak.
Thank you, Mr. Chairman. You know, we brought up this amendment for everything from Botox to abortion. I just want to assure members, over the weekend, Mr. Waxman's staff and our staff, we all been working on compromise language not to preempt, so we do not preempt state laws in regard to abortion services. And that debate will really come up in Division A. So I'd hope we would vote against this amendment. Mr. Waxman and I and all the staff's been working in good faith. This isn't, they're just, I hope we don't start throwing out abortion or reproductive services on every amendment we want to get through. There is a meaningful place where they come up legitimately in this legislation, and we're prepared to offer some amendments at that time, and we'll have our vote then. But I hope we're not going to start using reproductive rights as a red herring on every argument that comes up. So I'd hope we'd vote no on this piece of legislation. I'd yield the remainder of my time to Mr. Pallone.
Thank you. Yeah, I guess I'm just a little confused about what my colleagues on the other side of the aisle are saying, because all we're really doing here is saying that the state has to act like other employers, you know, your benefit package, whatever it is that they, you know, that we're requiring of other employers, that they would have to do the same thing. So I guess I philosophically don't understand if the other side is saying the state shouldn't have to do that, then you're going to have you know, people who have private employers doing one thing and, you know, putting certain requirements on that the states don't have to adhere to as employers. And it seems to me that that's not fair. And I don't know any other way to do this. I mean, this is like a hook that, as was explained, that we've used in COBRA and HIPAA and others to, you know, basically say if they don't do it, they're not eligible for federal funds under the Public Health Service Act. But I wouldn't want to see a situation where states didn't have to do what other employers do, whether it's the benefit package or whatever it happens to be. So I think I understand what my colleagues on the other side are saying, but I think that it's the wrong way to go. We should say that states have the same obligation as other employers, and this is the best way to proceed, and one that's already been tried and with COBRA and works. I yield back, Mr. Chairman.
Gentleman yields back the time. Further debate, Mr. Boyer.
Thank you, Mr. Chairman. I'll be brief. I just want to make this note. Both political parties will do this. It seems like we like to pick and choose when we want to set a federal standard and preempt, and when we want to then fight for states' rights. And we're all subject to that. So I just want to pause, though, and remind us that if, in fact, we want to set a federal standard, there better be a basis in fact for that overarching federal interest. So, for example, Mr. Chairman, when I made an amendment when we did the tobacco legislation to set a federal standard on fire-safe cigarettes, you said no. You said, no, Steve, we're not going to have, we're not going to override the states. Now you're arguing the complete opposite. But I just want you to know, even as I have voted for a federal standard for medical malpractice. So I will recognize that we do pick and choose when we want to have a federal standard, when in fact we want to give respect to our states. But if we're going to set that federal standard, I just think we need a good basis to say why we want that overarching federal interest. I yield back.
Further discussion of this amendment? Yes, Mr. Gingrey.
Mr. Chairman, thank you. The question was put to General Counsel by Ranking Member Barton. Could the Secretary, under this bill, could the Secretary tell the states that they would have to have a plan that covered, hypothetically, you say, abortion? And I understood the General Counsel said, yes, she could do that. He could do that. And then, Mr. Chairman, you said, well, I don't think that she would do that. In fact, we'll probably have some amendments that will come up later on in Division A or Division B to speak to that. Well, you know, here we are at the very outset addressing a problem that my colleague from Georgia, the ranking member on the Health Subcommittee of Energy and Commerce of this committee, recognized and has an amendment, a straightforward common sense amendment, where it makes sure that that would not happen. Why should we put off that issue until we get to Wednesday or Thursday or Friday or next week or whatever? Let's deal with it right now. I support the amendment. I hope my colleagues on both sides of the aisle support the amendment. It's clearly stated. There's no ambiguity. Let's prevent this, and let's prevent it right now. And I yield back.
Thank you, Mr. Gingrey. Further discussion on the amendment? If not, we'll proceed to a vote. All those in favor of the Deal amendment say aye. Aye. Opposed, no. No. The noes have it. The amendment's not agreed.
I would ask for a roll call, Mr. Chairman.
The gentleman requests a roll call vote. Let's proceed to a roll call.
Mr. Waxman.
No.
Mr. Waxman votes no. Mr. Dingell. Mr. Dingell, no. Mr. Markey. Mr. Boucher. Mr. Pallone. Mr. Pallone votes no. Mr. Gordon. Mr. Gordon, no. Mr. Rush. Mr. Rush passes. Ms. Eshoo. Ms. Eshoo votes no. Mr. Stupak. Mr. Engel. Mr. Engel votes no. Mr. Green. Mr. Green, no. Ms. DeGette. Ms. DeGette, no. Mrs. Capps. Mrs. Capps, no. Mr. Doyle. Mr. Doyle votes no. Ms. Harmon. Ms. Harmon, no. Ms. Schakowsky. Ms. Schakowsky votes no. Mr. Gonzalez. Mr. Gonzalez, no. Mr. Inslee. Mr. Inslee, no. Ms. Baldwin. Ms. Baldwin, no. Mr. Ross. Mr. Weiner. Mr. Weiner, no. Mr. Matheson. Mr. Matheson, no. Mr. Butterfield. Mr. Butterfield, no. Mr. Melanson. Mr. Melanson, no. Mr. Barrow. Mr. Barrow, no. Mr. Hill. Mr. Hill, no. Ms. Matsui. Ms. Matsui, no. Mrs. Christensen. Mrs. Christensen, no. Ms. Castor. Ms. Castor, no. Mr. Sarbanes? Mr. Sarbanes, no. Mr. Murphy of Connecticut? Mr. Murphy, no. Mr. Space? Mr. McNerney? Mr. McNerney votes no. Ms. Sutton? Ms. Sutton, no. Mr. Braley? Mr. Braley, no. Mr. Welch? Mr. Welch, no. Mr. Barton? Mr. Barton votes aye. Mr. Hall? Mr. Hall, aye. Mr. Upton? Mr. Upton, aye. Mr. Stearns? Mr. Deal? Mr. Deal votes aye. Mr. Whitfield? Mr. Whitfield, aye. Mr. Shimkus? Mr. Shimkus, aye. Mr. Shattuck? Mr. Blunt? Mr. Boyer? Mr. Boyer votes aye. Mr. Radonovich? Mr. Radonovich, aye. Mr. Pitts? Mr. Pitts, aye. Ms. Bono-Mack? Ms. Bono-Mack, aye. Mr. Walden? Mr. Walden, aye. Mr. Terry? Mr. Terry votes aye. Mr. Rogers? Mr. Rogers, aye. Mrs. Myrick? Mr. Sullivan? Mr. Sullivan votes aye. Mr. Murphy of Pennsylvania? Mr. Murphy, aye. Mr. Burgess? Mr. Burgess, aye. Ms. Blackburn? Ms. Blackburn votes aye. Mr. Gingrey? Mr. Gingrey, aye. Mr. Scalise? Mr. Scalise, aye. Mr. Markey? Mr. Markey votes no. Mr. Stupak? Mr. Stupak votes no. Mr. Rush? Recorded as passing. Mr. Rush votes off, pass on no. Mr. Ross? Mr. Ross votes no.
15 minutes.
Mr. Space? Mr. Space, no.
Brief everybody on it. It's
Do
just
you want a
like
caucus?
Mr. Shattuck?
let
Mr. Shattuck votes aye.
the minority committee staff brief the members' personal staff, so some of them are just not getting back. I mean,
Right.
Have all members responded to the call of the roll? If so, the clerk will tally the vote. Clerk will announce the vote.
On that vote, Mr. Chairman, there were 20 ayes and 35 noes.
20 ayes, 35 noes. The amendment is not agreed to.